All right, let's talk about something so many of us deal with, but maybe don't fully get: acid reflux. You know, that flame. We're going to tame that flame today, breaking down everything from what causes it to how you can manage it for good.
You know the feeling, right? That uncomfortable burn after a big meal? We've all had it. But what happens when it's not just a one-off thing? What if it's your body trying to tell you that something a little more serious is going on?
Okay, so let's get right into it. What is actually happening inside your body when you feel that burn? Well, we're talking about a condition that has a name: GERD.
So the official name is gastroesophageal reflux disease. Yeah, it's a mouthful, so we just call it GERD. And what it boils down to is this: your stomach contents are basically going the wrong way, flowing back up into your esophagus. Imagine there's a little muscular gate between your esophagus and your stomach. It's supposed to be a one-way street, right? Well, with GERD, that gate is kind of faulty. It's not closing all the way, and that lets harsh stomach acid sneak back up where it absolutely does not belong. And that's what causes that burn and can lead to bigger problems down the line.
And here's where it gets tricky, because it's not always just about heartburn. I mean, sure, that's the classic sign, along with regurgitation. But look at this table. GERD can be a real chameleon. It can show up as chest pain, make it hard to swallow, or even cause things you'd never connect to your stomach, like a nagging cough, a constantly hoarse voice, or even wearing away at your teeth. It can totally mess with your sleep. I mean, it really can have a huge impact on your daily life.
So, with all these possible symptoms, you're probably wondering, okay, when is this serious enough to actually go see a doctor? And what's that visit even going to look like? Let's cover that.
All right, listen up, because this is important. There's some things you just don't ignore. We call these alarm symptoms, and they are absolute red flags. If you have any trouble swallowing, or if it hurts to swallow, if you're losing weight and you're not trying to, or you see any signs of bleeding or just can't stop vomiting, that is your cue. It's time to call a doctor right away. These signs mean we need to rule out anything more serious.
So, what happens when you go to the doctor? It's actually a pretty straightforward process. First, they're just going to talk to you, right? They'll ask all about your symptoms, both the typical and the weird ones. Then, they're going to check for any of those alarm symptoms we just talked about. And if they think they need a better look, the go-to procedure is an endoscopy. It sounds intimidating, but it's really the best way for them to get a direct view of your esophagus and see if there's any inflammation or other damage.
Now, before we even talk about pills, the first line of defense, and honestly the most powerful one for a lot of people, involves changes you can make yourself. It all starts with your diet and your daily habits.
So building a reflux-friendly plate is a game changer. You want to focus on things like lean chicken and fish, lots of fresh veggies, whole grains, the good stuff. Now, the avoid list. This is where the real culprits live. Fried and fatty foods are a big no-no because they just sit in your stomach forever, slowing everything down. And then you have the things that actually relax that little valve we talked about. We're looking at coffee, chocolate, and alcohol. Spicy foods and acidic things like tomatoes can also just directly irritate an already sensitive esophagus.
And it's not just about what you eat, it's how you live. These little adjustments can make a massive difference. Propping up the head of your bed a bit uses gravity to help you out while you sleep. A big one is not eating for a few hours before you lie down. That gives your stomach time to empty. Oh, and simple things like avoiding super tight clothing that squeezes your belly, that actually helps. And if you're carrying extra weight or you smoke, tackling those can have a huge impact too.
Okay, but what happens if you've done all that? You've changed your diet, you've tweaked your lifestyle, and you're still struggling. Well, that's when we look at medication. And doctors have a really logical step-by-step approach to this.
First up, you've got your antacids. Think of these as the firefighters. They rush in for quick, immediate relief. They don't prevent the fire, but they work super fast to neutralize the acid that's already there, putting out that burn. It's a great temporary fix.
All right, step 2 is a class of drugs called H2 blockers. Now, these are a bit more sophisticated. Instead of just cleaning up the mess, they actually go to the source and tell your stomach to calm down and produce less acid in the first place. The relief you get from these lasts a whole lot longer than an antacid.
And then we have the heavy hitters, proton pump inhibitors, or PPIs. These are the most powerful tool in the shed for GERD. They work by literally shutting down the tiny pumps in your stomach that churn out acid. By drastically cutting down on acid, they don't just stop the symptoms, they actually give the damaged lining of your esophagus a chance to heal. This is huge.
Now we have to talk about the long game, because managing GERD isn't just about feeling better today. It's really about preventing some pretty serious issues down the road. And this is why sticking with a plan is so important.
So one of the biggest long-term risks of uncontrolled GERD is a condition called Barrett's esophagus. Here's what happens. After years of being bathed in stomach acid, the cells lining your esophagus get so damaged that they change. They morph into a completely different type of cell, one that's more like the lining of your intestine. And that change, unfortunately, is considered a precancerous condition.
And if you need a number to understand how serious this is, here it is. Someone with Barrett's esophagus has a risk of developing a specific type of esophageal cancer that is anywhere from 30 to 125 times higher than the average person. That's a staggering number.
Okay, I know that number sounds really scary, but it's not meant to cause panic. It's meant to be a wake-up call. It highlights exactly why managing this condition for the long haul is non-negotiable. It's why regular checkups are so critical. This is all about prevention. It's about staying way ahead of the problem.
Now, for a very small group of people, medications just don't cut it. Or maybe they can't take them long term. In those cases, surgery can be an option. The main procedure is called a fundoplication. And it's basically a way for a surgeon to mechanically reinforce that leaky valve. It's definitely not the first choice, but it's an important option for those with really severe, stubborn cases.
So we end up right back where we started, with that burning sensation. But now you know it can be a sign of so much more. The big takeaway here is simple. Listen to what your body is telling you. That persistent heartburn isn't just something you have to put up with. It's a signal, and it's a conversation that's absolutely worth having with your doctor, for your health, today, and for years to come.